Good afternoon. Welcome back to Kids Health Talk by MGM Children, Department of Pediatrics and Neonatology, MGM Healthcare Chennai. We would like to thank all the parents for supporting us in all our sessions. Today we have Dr. Deepa Easow. She is a Senior Consultant, Department of Pediatrics and Neonatology, MGM Healthcare. Hello, madam. So today we know that we are almost in the second wave of a pandemic, and today we are going to deal with one of the most important and interesting topic, that is COVID-19 in children. So what a parent should know, what are the facts and myths that the parent should know? We have madam here, so she'll be clearing all her doubts and concerns. Okay, before starting the session, I would like to make a point that we're not wearing the mask here is because we are in a controlled environment, and so for a better audio quality, we are just removing our mask. And then, ma'am, can we start the session now?
Yes.
Okay. So, ma'am, you know that we are amidst of COVID pandemic, second wave. So, how is it in children, ma'am? Is there increase in children in this particular wave, and how do they get infected, madam?
Good afternoon to all the viewers. COVID-19 has been around for more than a year now. And just when we thought that we had almost controlled the pandemic, all of a sudden we are in the midst of a second wave. And the second wave came so dramatically, so suddenly, and there was a sudden surge in the number of cases. So similarly, we did see a surge in the number of pediatric cases also. That is proportionately when the adult numbers go up, you see an increase in the pediatric cases. So according to data that is available, there was a 20% increase in the number of children that were affected by the second wave. There are some other ways in which the second wave was different from the first wave. In the first wave, what we saw was most of the children were asymptomatic. Parents tested positive, and because they were worried, they tested the child, and the child tested positive. But the child did not have any symptoms. Unlike that, this time we are seeing more children with symptoms. Most of them are coming with symptoms, and they are not asymptomatic. And the other difference that we are seeing is that many of the children are showing gastrointestinal symptoms. They are presenting with symptoms such as diarrhea and vomiting, which was not seen too much in the first wave. So this is a couple of things that we see differently in the second wave right now. And of course, the current strain that is causing the surge is definitely more transmissible and more infectious. So one person in the family gets infected and we see the whole family infected. So these are the differences that we are seeing. So as far as the numbers are concerned, as I said, there was a 20% increase. But the good thing is almost 80 to 90% of the children have only mild illnesses, which do not require hospitalization. Most of them will go with just home care and with just symptomatic treatment. It's only about 1% of the children who land up in hospitals requiring hospitalization. And of the 1%, about 5% of them develop severe COVID going into the intensive care unit. So those numbers are still very reassuring, because the good thing is that we still aren't seeing, though we are seeing more numbers, more children getting affected, we are not seeing children with very severe forms of COVID as yet. So that is what the difference we are seeing in the second surge is.
Okay. So now, like we all say, to prevent COVID-19, no, we say that we have to wear mask, hand washing, and all that. Do children really need to wear mask? And in that case, what kind of a mask do children need to wear?
That's a very good question, because right now the only weapon that we have in our armory to protect children is probably masking. Because children, we still do not have a vaccine that has come up with. So masking is very important. The WHO and the CDC say that children above the age of 2 years can definitely be taught how to wear a mask. And children up to the age of 5 years definitely need to be supervised when they are wearing a mask, because there is a chance that they can misuse the mask, and they can have problems with that. So children above the age of 2 years should wear a mask. A normal healthy child can wear a cloth mask. And to get a child to wear a mask can be pretty intimidating, because all of a sudden, the child having the mouth and the nose closed. So it is good that parents make it as child friendly as possible. So get a mask with probably a fabric which has got their favorite cartoon character, and get the mask put for their favorite doll, so that they realize that this mask is not anything very scary. And that is all that is needed. The important thing is the mask has to snugly fit the child. It should cover the mouth as well as the nose. So it should be the correct size. It should not be an oversized mask, because then there is no point in wearing the mask. So that is what a normal, healthy child needs to wear. And the mask should be changed daily, should be washed with warm water and put out in the sun and dried. That's what a cloth mask is. That's how a cloth mask should be used. Now, supposing there's a child which has got a comorbid condition, who is at high risk for COVID, those children, we usually say it is good that they wear a surgical mask, because it gives more protection. So it is important that all children, especially when they are going out, they're stepping out for any reason, they should wear a mask. And it is good to get them used to wearing a mask by getting them used to the concept of wearing a mask at home. So you could probably reward them for wearing a mask for some time at home. And as I said, make it as child-friendly as possible, so that the child gets used to the fact that this is not going to suffocate me. I can still breathe wearing this.
Okay. So, why do children get milder illness, ma'am? Because we see adults, they go into a severe illness, but we don't see children going into that severe illness.
Yeah.
We see most of it is mostly a milder, something like that. So, why is it like that in children?
Yeah. That's a good question. There are many theories being put forward as to why children are have a milder infection. That probably it could be due to one reason that is being said is this virus, this coronavirus, has got spike proteins on it, and the way it gains access into the body is it has to attach itself to certain receptors in the body known as ACE2 receptors. So the number of ACE2 receptors in children is supposed to be far lower than what it is in adults. So the virus is unable to attach itself to too many receptors. So that could be one of the reasons that the children do not have such severe infection. The other reason that has been postulated is children, COVID is caused by a coronavirus. There are other coronaviruses which cause the common cold. So children usually are prone to develop common colds and coughs and all that, which could be caused by coronavirus, and that could offer some kind of cross protection. So there is a kind of competitive inhibition, and so that because of that they don't get such severe infections of COVID. That could be another reason that is being postulated. And the immune system in children tends to work a little differently from what it is in adults. In adults, the immune system tends to overact, and that is when the cytokine storm develops and they go into problems. So most children don't develop things like that. The other theory that is put forward is vaccinations such as BCG and MMR providing some kind of protection. Now, whether that is true or not, studies are going on, so we still do not have concrete data as to whether it definitely provides protection or not, but this is another reason that is being said. And the other reason, of course, is I think children are being protected right now. Schools are closed. They are not going out into the open. So because of that, for them to get infected with a large viral load also is much lesser. So this is why thankfully, we are seeing children getting much lower, much milder infections than what adults are getting.
Okay. So, Madam Ipo, recently we are seeing a lot of kids, they're coming with CT scan and all that. So, is it really needed that we should do CT scan for children? And what are the tests that are required if we suspect COVID in a children?
Okay. So, as I said, most children, they get only a mild illness, which really does not require too much of testing. Now, if a child is running a temperature for more than 3 to 4 days and it's a high-grade temperature, then we advise the child to undergo the basic investigations. But even then, a CT scan is not one of the first investigations that we would ask for a child. So, most often, a CT scan is never asked for a child. There are very rare conditions where a CT scan is asked for a child. So if at all a child is tested positive, there is no need for parents to panic and run and go and get a CT scan done as the first investigation that is done. All that they need to do is contact their primary care provider, and then their pediatrician will be able to guide them regarding what needs to be done. Even regarding testing for COVID, So a child has had a contact with a COVID positive adult. It is not necessary if the child is asymptomatic that you have to run and go and do a test for the child. You just need to keep an eye on the child for the next 2 weeks, because the incubation period is usually up to day 14. If a child develops any symptom, then that's an indication that you need to do an RT-PCR for the test. And if the RT-PCR for a child is done exactly like the way it is done for an adult, so we do a nasal swab and an oropharyngeal swab, and that is exactly how it is done, and that can be done. And if it is positive, then we decide on whether the child requires further investigations. So the other indication for doing a test is probably a child before undergoing a particular procedure. For example, a child has to undergo a surgical procedure. Now, most hospitals insist that a child has to have an RT-PCR, which is negative, because if you do a surgical procedure in a child who is COVID positive, usually the postoperative complications are more, and you don't want the child to land up in those kind of problems. So because of that, we always do a screening RT-PCR before a child is taken up for a test. So these are the indications in which even an RT-PCR is done for a child. Other than that, for a child to, an asymptomatic child to just go and do a CT scan or an RT-PCR just because somebody in the family is positive is not needed at all. And CT scans are, after all, radiation, and we do not want to unnecessarily expose our children to radiation unless and until it is absolutely necessary.
Ma'am, having said that, how do we manage a COVID positive child, and what all should we monitor in a COVID positive child?
Yeah. A very good question, Dr. Namya. As I said, if a child is tested COVID positive and the child is asymptomatic, you just don't need to do anything. You just need to monitor the child, check the child's temperature, probably maybe 3 times a day, check the temperature. If the child is running a temperature, then all that is needed is paracetamol. Fever is actually a good thing. Fever is the body trying to fight the infection. So we don't have to be in a hurry to bring the fever down in all children by giving medications such as ibuprofen and mefenamic acid and things like that, unless and until the child is very uncomfortable. So all that is advised is paracetamol to bring the temperature down. If the temperature is still very high and the child is very uncomfortable, all that we need to do is tepid sponging, which is done with tap water, where you wipe the child down so that the temperature is brought down. Apart from that, the only other thing that needs to be done is you need to keep the child well hydrated. So most of the time when a child is running a temperature, the child tends to have a loss of appetite. So the child will refuse to take food. But it's important that at least the child is given plenty of liquids and kept well hydrated. So you need to monitor the hydration of the child. And a good way to monitor the hydration of the child is monitor the urine output. Now, if the child is passing plenty of urine and the urine is clear colored, it's not high colored urine, that's an indication that the child is well hydrated. So keep an eye on the activity of the child. Most children, when they are running a temperature, will tend to go and lie down and be a little lethargic. The moment the temperature comes down, they'll usually become very active and run around and play. So if a child is not doing that even when the temperature comes down, that is an indication that there is something wrong. And that's an indication that you need to contact your primary healthcare provider and get an opinion from them as to what next to be done. The other important thing that needs to be monitored is the breathing of the child. So children tend to breathe faster than adults generally, and the respiratory rate at different age groups is different. But generally, you will know how your child breathes. So at any point of time, if you feel that your child is struggling to breathe, is making a sound when the child is breathing, or the child is breathing faster than normal, or there is an indrawing of the chest wall. So any of these things are happening, that is an indication that you need to take the child to the hospital. Monitoring saturation with a pulse oximeter might be a good idea in older children. In very small children, like an 8-month or a 9-month-old baby, if you use the pulse oximeter that is being advised for an adult, for that child, that might show you a wrong reading because it's not fitting correctly for that child, and it might just lead to unnecessary panic on the side of the parents. So using a pulse oximeter all the time might not be a very good idea. Otherwise, you need to get pulse oximeters which are meant for children of that age. Older children, of course, definitely checking their saturations 2 or 3 times a day might be a good idea. And if the saturation is less than 95%, that is an indication that you need to contact your primary healthcare provider. So basically, the activity of the child, the breathing of the child and the temperature of the child, these are a couple of things that you need to monitor. And as long as this is all right, that shows that your child has just got a mild infection and nothing is going to happen.
Okay. So, having said that, be it a mild infection or whatever, we often used to face this question, Madam, idu COVID, Madam, idu COVID illaya. So, how do we able to differentiate whether if it's a COVID or if it's a non-COVID?
Yeah. That is extremely difficult because COVID being a viral illness, it tends to produce symptoms like any other viral illness, like a fever. A child can have a fever, just a fever in some children. A child can have a runny nose, can have mild throat pain, body pain, can have diarrhea, can have vomiting, just like any other illness. So it is very difficult by just listening to the symptoms that whether it is COVID or it is non-COVID. Now, if a child has had an exposure to a COVID positive adult, for example, there is a COVID positive adult, then your index of suspicion goes up very high. You feel that this could be COVID, and there is a good possibility of testing. Now, if nobody else in the family has got any symptoms of COVID, everybody else is fine, and the child is the only one with symptoms, then ideally we have to think of non-COVID causes also, and we need to contact your pediatrician so that your pediatrician will guide you as to what are the investigations that need to be done. Definitely RT-PCR will be one of the investigations because during this season, every fever is considered to be COVID unless proved otherwise. So RT-PCR would be one of the reasons, but there would be other causes also that we need to think about. So non-COVID causes of fever also should be in our mind. So we should not label everything as COVID, but just with the symptoms, it is extremely difficult to say whether this is COVID or a non-COVID.
Okay. Now, almost the COVID comes in clusters. So, in a family, say if a mother is COVID positive and the child is not COVID positive, or if the child is COVID positive and the mother is negative, in that case, how a positive mother can take care of her child?
Okay. That's a very good question. A scenario that is being faced by a lot of families now, because they are unable to find another reliable healthcare, care provider, a caregiver to take care of the child. So if the parents have tested positive and the child is negative and they do not have another reliable person to hand over the child can be kept with them. And an older child should be asked to sleep alone and to stay separately in a room, to use a separate toilet, and keep the child away as much as possible from the parent. Now, if the child is a very small child, then that will be difficult. So the child will want to be with the parents. So parents should follow usual COVID appropriate behavior, such as always wearing a mask even in the house and hand washing. So this is something that they should follow. And the important thing is protect the grandparents in the house and protect other people who have got comorbids. So just because parents have tested positive and the child has not shown symptoms, it might not be a very good idea to send this child off to the grandparents' house, because you never know. The child might be having the infection and being asymptomatic, could be an asymptomatic carrier of the infection. So the child could take the infection and infect the grandparents, and that they might end up having a more severe illness. So sending the child to someone older like that might not be a very good idea. Better than that would be either, if you have a reliable caregiver who is younger, who can take care of the child, that might be an option. Otherwise, keep the child with you and follow COVID appropriate behavior.
Okay. Ma'am, there is a post-COVID complication, they say, right? Something called as MISC. What is this MISC, madam? Can you please explain it elaborately?
Yeah. So the full form of MISC is multi-system inflammatory syndrome of childhood. So this is a condition that is not seen during the acute COVID infection. Usually it is seen in children a couple of weeks to months after the COVID infection. So the child might have had an asymptomatic COVID infection, might have had no symptoms at that time and can still develop this condition weeks or months later. It is an inflammation that takes place in multiple organs in the body, multi-system. That is why it's called multi-system inflammatory. So it's an inflammation that takes place in multiple organs of the body, where the organs get affected because of a reaction to the COVID infection. So at the time of this MIS-C, what happens is, if you do an RT-PCR, it will be negative. But if you do an antibody test, it will be positive. So that is what it will show. That it will show that the child has had an exposure to COVID sometime in the past. And that could be any time between 2 to 3 weeks after the acute illness, or even up to 3 months. Now, what are some of the symptoms that the child will usually present with? So usually the child will have fever again. And usually this time the fever will be very high. The child will usually be very sick looking, will be lethargic, could have diarrhea, could have abdominal pain, could have vomiting, could have a rash all over the body. Any kind of a rash is possible. Could have eyes that are red. So usually this will be a very sick child. And so it is extremely important that parents keep an eye on their child for this condition. It is extremely rare in pediatric children. I know, I must say that though we are talking about it and it sounds very scary, I must reiterate that this is a condition which is very rarely seen, but parents should be aware of this, because it's a condition, if picked up early and treated early, has got very good prognosis. So the problems arise when there is a delay in the diagnosis. So if a child who has recovered from COVID, who has had an exposure to the COVID virus, develops fever again, with a rash, no matter what kind of a rash it is, parents should not ignore it and thinking that it's just an allergy and things like that. Parents should contact their primary healthcare providers, and treatment should be started immediately. There are certain tests that can be done, blood tests that can be done to diagnose the condition. And based on the investigation reports, we start treatment. And if treatment is started early, the prognosis is very good.
Okay. Ma'am, we've been seeing people has been hunting for this remdesivir, steroids, favipiravir, remdesivir. When do we really need to use them?
See, none of these drugs are meant for use in mild cases of pediatric COVID. And as I said, 80 to 90% of the children have mild disease, and all that they require is paracetamol. And you can give them multivitamins. Zinc, vitamin C will do no harm. Not that zinc and vitamin C is going to cure COVID, but it's okay to give that. There is no harm in doing that. Other than that, all these other drugs, have got no, especially favipiravir and the hydroxychloroquine and all these kind of drugs have got no role in pediatric practice. Drugs such as steroids and remdesivir are only used in hospitalized children. So once the child, is requiring oxygen, either for COVID pneumonia, or the child later develops MIS-C, then the child is started on steroids. So it is extremely important that medications like this are not started by parents just because it has been prescribed for them, by their physician, thinking that, they are unable to contact their pediatrician, and it's the middle of the night, and I'm unable to contact my pediatrician. So why not just give half the dose of all of this that has been prescribed to me, to my child, so that at least, I won't be late in starting treatment. None of this has been proven to be of any benefit. In fact, it will cause more problems if children are started on all these kind of medications. So, and it is also extremely important that children are not started on antibiotics. See, COVID is a viral illness, and in no way is an antibiotic going to help. So the parents should not be in a hurry to go and across the counter go and buy an antibiotic and start it, unless and until your pediatrician suspects a secondary infection and feels that the child needs to be put on an antibiotic, then of course. So no medication apart from paracetamol should be given without consultation with your pediatrician.
Okay. So when we're talking about steroids, I remembered this black fungus. Everywhere there's black fungus. So is it common in children, madam?
Yeah. The surprising thing is black fungus is not a new disease, unlike COVID. COVID, is a new disease. We've never heard of COVID before 2019, I think. But black fungus is there. It has been around. It's just that we are seeing a surge of cases. Now, it's a fungus that is seen in the air, it is seen in soil, it is seen in organic matter. So that it has been there all around all the time. And usually it tends to affect people with the immunocompromised state. That is, their immunity is low. And that is when this fungus tends to affect people. So COVID is a condition which tends to play havoc with the immune system. And when steroids are given, for when it absolutely has to be given, that tends to affect the immune system even further. And especially if they have underlying conditions such as diabetes with uncontrolled blood sugars, then again it tends to give them there is a risk of this black fungus affecting them. Now, does it affect children? Yes. In the last couple of days, there have been certain cases being reported in children who are recovering from COVID, but most of them have been children who have got diabetes, juvenile diabetes, and that is how they've been affected. So the symptoms that usually they need to look out for in children who have got these kind of underlying features, that immunocompromised children, the so-called high-risk children that we say, diabetic children, the immunocompromised children on immune suppressants, and children like that, if they have nasal blockage or a abnormal nasal discharge, severe headache, swelling on one side of the face, and things like that, it should not be ignored, and they should consult with their pediatrician and their ENT surgeon.
So I get a lot of questions from my patients that a few kids are on a chronic illness. So is it okay for them to go on with the routine medications when they're COVID positive?
Yeah, a good question. It's extremely important that children with chronic conditions continue their medications. And none of those medications should be stopped unless and until it is discussed with their primary care provider. Because these children need those medications to keep the other conditions under control. So if those medications are stopped without any pre-warning, those conditions, there's going to be an exacerbation of those conditions, and you don't want those conditions to cause more problems if at all the child gets affected with COVID. So my advice would be, continue the medications, continue your consultations with your primary care providers, everything as you would do in a non-COVID situation. And as per the guidance of your pediatrician, then make the necessary changes that need to be done.
So in this pandemic situation, all of us are stressed. So how is it affecting the children, and how can parents help the children combat the stress in this situation?
Yes, that is something that we are seeing a lot. And the sad part is children are unable to express that they are facing stress. So most of the time they present with vague complaints. They are unable to sleep, they don't eat properly. I had a child, the mother was saying that the child frequently keeps running to the toilet saying that the child wants to pass stool, but wouldn't pass and then come back. So this was happening recurrently, and other than that, there was no other complaint. So finally, when you kind of talk to these children, you realize that they are scared. They are scared of what is going to happen to them, what is going to happen to their parents, and they don't have a way of letting it out. So children have been facing a lot of changes. They've been away from schools, which is a big change, a big change in their life. They don't meet with their friends. So they don't have many children like to talk to their friends, express their concerns to their friends. And when all of them talk, they feel better. And this, they are not able to do that. So, and there is no structured routine to their day. They get up and they don't know what to do. And then there is this TV being switched on the whole day, where you have news channels flashing pictures of, people dying and people being buried and all that. So these are things that can really stress out children. It's extremely difficult. Older children are worried about their future. They do not know about the exams, whether they're going to be, be conducted. Many children are finding it difficult to cope with online classes. They do not know how to do that. So there are a lot of issues. So some of the things that parents can do to make things easier for their children is spend a lot of time with your child. Talk to your child, smaller children, try to talk to them about what COVID is. Tell them that it is just another illness and there are ways of protecting ourselves from it. And some of the ways by which we can protect ourselves from it is by masking, by hand washing, and be role models to them. Hand wash, wear a mask, and don't be going out unnecessarily. So when children see things like this, then they realize that, okay, so there is a way that I can protect myself, and my parents are also protecting themselves from the disease. So, and older children can of course be given more details about the illness and what precautions that they can take. It's important that conversations about COVID are kept to the minimum. So parents should not be all the time talking about COVID and all the bad things that COVID is doing and about people dying and things like that. Instead, have a good time, dinner time or lunch time. Have a good conversation going on at the table. Try to talk about happy things, about holidays that you're going to take soon, and things like that, about their future and things like that, so that children have got something to look forward to. Have a structure to their day. What would they do if they were going to school? So similarly, make the child get up on time in the morning, have a good breakfast, and then have some kind of a structure, some kind of a study time, then a play time. Involve the children in household chores to help out, making smaller children making their own beds, older children maybe helping out in the kitchen and things like that. So that will get their mind off, and reward them when they do things, and appreciate them when they do things, so that children get their minds off this and they keep themselves occupied. Reduce screen time as much as possible, because that has got a lot of detrimental effects on children. They don't sleep well. So make sure that the screen time is restricted based on the age of the child. And definitely all screen time should be switched off at least 1 hour before bedtime. They should go to bed daily at the same time and get up at the same time, so that they have a good sleep routine. And of course, junk food should definitely be avoided. A major problem that we are seeing with a lot of children over the last 1 year, that this COVID pandemic has been raging, is almost all children have put on weight. Parents, when they call us, they say, children have just been putting on weight. We don't know what to do. And that is not something which is very good, because, as I said, among high risk children, children which come into the high risk group who develop more severe complications of COVID, one of it is obesity. So an obesity is having a body mass index which is higher than normal for that age, and most of the children, especially the adolescents, and are falling into this. They come into obesity. So it's extremely important that junk food is avoided, and some kind of an exercise routine is done for them within the confines of the house. Whatever can be done. Smaller children, you can have a play time. Parents can play with the children, because it's not advisable at this time to allow children to play with even the next door neighbor, because you do not know, whether they are carriers of the virus. So within the confines of the house, parents can organize some kind of a game so that children are kept occupied. So this is the way by which we can take care of both the physical health of the child, by keeping them fit, and at the same time taking care of the mental health, which is extremely important in improving the immunity of the child. Most parents want to know, how do you improve immunity of a child, and they want medications to improve immunity. Mental health plays a major role in improving immunity of children. Unless they have good mental health, their immunity is not going to be strong. So it's extremely important that they sleep well, and they are not stressed out.
So now this is going to be a question of all new moms, new moms who's delivered. So can a breastfeeding mom who is COVID positive, can she feed her baby, ma'am?
Absolutely, yes. Studies all over have done that the advantages of breastfeeding are much more than the possibility of the mother transmitting the infection to the baby. So if the mother is not sick, and the mother is well enough to carry the baby and feed the baby, definitely the mother should feed the baby. But of course, take precautions. Definitely wear a mask when you're feeding the baby, and definitely hand wash before you carry the baby. So this is something, and the rest of the time, try to keep the baby away from you. If you have another healthy person to take care of the child, let them handle the child, and you carry the baby and feed only for the sake of feeding. The other option that you have is, of course, express the milk and give it to the healthy care giver, so that they can give the milk. So that is also an option, but breast milk definitely should be continued for these newborns.
Okay, so talking about vaccines, ma'am, now government is emphasizing everybody that above 18 years should go and get vaccinated. So when are we expecting for kids less than 18 years?
Yeah. That's a good question, and I think parents are waiting for this. Of course, US and Canada and all that have started vaccinating children above the age of 12 years. But unfortunately, in India, we still do not have a vaccine for children. Most of the vaccines are still undergoing phase 2 and phase 3 trials. So it is definitely going to take some more time because we need to be very sure, about the safety before we give the vaccines for children. So as a result, it is extremely important that we wait for the trials to be over to be able to get vaccines that are safe for children. But parents can be rest assured that once the vaccines are made available, they will be very safe for children, and all parents should go and get the vaccines done for the children. At the moment, the way parents can protect their children is by themselves getting the vaccines, because when they get the vaccines, then they are protected from the illness, and thereby they will not carry the virus to the house and infect the child. So it is important that all adults go and get the vaccines.
Okay. Does this flu vaccine protect against COVID-19, ma'am?
That is a good question. There is a small study done in the US which has said that children, I think it was done in Michigan, which showed that children who had got the flu vaccine had milder illness when they got infected, had lesser chances of getting infected. And when they got infected, they had a milder illness. But of course, that data is not enough for us to extrapolate it and say that flu vaccine is definitely going to protect against against COVID. But definitely, it is a good thing for children to get their flu vaccine when this pandemic is going on, because flu and COVID tend to have very similar symptoms. So we do not want children to land up with flu, because unnecessarily it's going to be a burden on the healthcare system if children land up with flu, and then us not knowing whether we are dealing with COVID and flu, and then we'll have to do a battery of tests to diagnose and all that. So a child being protected by flu will take a big burden off the healthcare system. So it's definitely a good idea to get your children protected against the influenza by taking the flu vaccine.
Okay. Now, if we say that a child is tested positive for COVID, but he's due for his routine vaccination in a week or two, so how do we go about it, ma'am?
So a child who is tested positive, as usual, should complete the 14 days. And after that, if the child is due for a vaccine, the child can go and get the vaccine taken. Okay. So there is no need to postpone the vaccination. So, and at the same time, if the child has had a condition such as, MIS-C, or has had a condition where the child has been on steroids and IVIG and things like that, that is a condition scenario where we might have to postpone the vaccines for a longer time. But if a child has had just a mild illness and is in home care, and has had just fever for a couple of days, so once the child completes the 14-day quarantine, the child can go and get the vaccine taken.
Okay, so that also says that routine vaccinations can be taken in pandemic.
Absolutely. So we definitely want all parents to get their routine vaccinations, especially for children less than 2 years, because we do not want a breakthrough infection of any of the vaccine preventable diseases, because that would be disastrous on our healthcare system. Already the healthcare system is burdened with handling COVID, and just supposing, we have a outbreak of polio or meningitis or diphtheria or pertussis, these are all conditions that are being protected in the first 2 years of life. And just because parents are scared to go to a hospital, they don't take these vaccines. We don't want children landing up with these kind of illnesses, which can be which are very much more severe than COVID in a child. So we definitely do not want that, and I'm sure the pediatricians are taking proper precautions and following all the COVID appropriate behavior to give the vaccine. Parents also should take precautions, preferably use your own transport and take the child to the hospital, preferably book an appointment so that you won't have to go and wait for a long time and there is no overcrowding. Here at MGM Children's, we are giving all the vaccinations, and we have been giving it throughout the pandemic, especially for children less than 2 years. And we make sure that all children are screened, and so that no children with symptoms do come in to the OPD. So it is only children who are coming in for vaccines who come into the OPD. So we make sure that it is a very safe environment for children, for parents to bring their children and get their vaccines taken confidently. And there is no contraindication for taking any vaccine during this pandemic. So all routine vaccinations should be given, especially for children less than 2 years. If it's a booster dose and your place is under lockdown, postponing it for some time might be all right, but not for children who are less than 2 years.
Okay. So already there is a lot of stress. So we are in the second wave. So we are expecting a third wave. That is what they have predicted, probably in October or something, they say. So how is it? And they say it's going to be pediatric age group. So how are we going to do it?
Yeah. Pandemics usually come in waves. That's the way, if you look at all the history of pandemics in the past, usually there are multiple waves. And that is how, and then they finally die out and become a seasonal illness. So that is usually the history of a pandemic. So the possibility of another wave is definitely there. And mathematical and statistical analysis, that is computerized analysis, has said that probably children will be more affected. But as I said, with the current data, we do not have any data to prove that children are going to be more severely affected, or that there are going to be more numbers. The possibility is there because children are going to be the vulnerable population, because children are the ones who do not have any vaccination at the moment. So there could be an increase in the number of children that are going to be affected, but we can be optimistic and hope that it will be the same way that like it was now, and children will not get severe illnesses. So 1% of the children affected going into hospitals is not too bad a number. So I don't think there is anything for us to panic. We just need to take proper precautions. And as I said, children currently with schools closed are getting infected only from parents. So it is important that parents follow COVID appropriate behavior. Do not take your child out to supermarkets and to family functions and any place where there is a crowd. Try not to go to places like that, and keep yourself protected and keep your child protected.
Okay. So, ma'am, we have few questions in our chat box. So, there is a mother who has asked that she's been feeding her mother for 1.5 months. Feeding her baby for 1.5 months.
Okay.
So, can she get vaccinated?
Yes. Currently, the government of India has said that all lactating mothers can take the vaccines, and the vaccines are very safe for mothers who are breastfeeding. So, breastfeeding mothers can go ahead and take the vaccine.
Okay. So, what precautions we need to take to avoid major risk due to COVID? Like, is there any diet plans or any medications like Zinc-COVID?
As I said, a good healthy diet. Give the child a balanced diet, that you would do normally, and that is something that we would advise all the time. We would advise a child to get
Sorry, there was a technical glitch. So now can we continue?
Yeah, I think I was talking about how we can keep a child healthy. The most important thing is a diet. As I said, give a balanced diet, a balanced diet that you would normally give any child, with carbohydrates, proteins, fats, vitamins, and minerals, make sure that the child is kept off junk food. Make sure that the child is not sitting in front of the TV and just munching on food and putting on weight, because as I said, obesity is a risk factor. So apart from that, as I said, giving multivitamins is a good idea. There's no harm in giving vitamin C, zinc, or just any multivitamin syrup to improve the immunity of the child. There is no harm in that. So that definitely can be done with the prescription from a pediatrician.
Ma'am, there's a mother who's asked how to protect under 2 year children from this pandemic. Like we know those kids are uncontrollable,
Yeah.
toddler age group.
And probably their concern is that under 2 years we are not advising them to wear a mask also. So maybe the mother is concerned that these children might not be protected. Yes. So the way that you can protect your child is, do not take your child out anywhere unless and until it's an absolute necessity. And especially if you have to, do not, especially to supermarkets and to crowded places, to family functions and all that, do not take the child out, especially because this child doesn't have a mask on. The only place that you probably should take your child to is probably a hospital, for the regular vaccinations that need to be done. And one thing that you can do is, once you get the child back home, you can probably give the child a bath, so that you can keep the child clean. And a child is definitely going to get infected from an adult. So the important thing is, the parents should keep themselves safe and not get infected. So you should not be having visitors coming to your house, people coming in. It could be even people who are coming in to do some kind of a work in the house. So if at all they're coming in to do some kind of a repair job in the house, you should make sure that they are masked, and they are not running a temperature, and they should hand wash before they enter the house. So these are ways by which you can protect your child, and make sure that till this pandemic is over, these children are not exposed to the virus.
Okay. So there's one more question, ma'am. The mother has become COVID positive, and she has developed antibodies also. She's been tested for it. So she says she has 21 points of her antibodies. And then now she's feeding her baby. Her question is when she can get herself vaccinated next.
Okay, usually now they say that after a COVID infection, usually they say after 3 months they can go and take the vaccine, is what the recommendation right now is. So she probably would have to do that, or probably consult with her physician, who will be able to give her advice on that.
Okay. Thank you, ma'am. We have come to an end of a session.
Yeah.
I think that was very enlightening for all of us, ma'am. So I thank all the parents for supporting our kids' health talk sessions. So if you have any queries or if you have any concerns regarding this pandemic, you can anytime walk into MGM Healthcare. We are available here 24/7, and we have facilities for COVID ER and COVID ward and ICU. So we are here 24/7, and we'll be able to take a good care of the community. Thank you. Thank you, ma'am.
Yeah, thank you. Thank you, Dr. Ramya. Thank you for your patient hearing. All that I would like to say in summary is, COVID-19 is a mild illness in children. So I would definitely request parents to not panic if children get tested positive. And please, because when we panic, we tend to do rather irrational things and unnecessary things, and that should not happen. So I'm sure your pediatricians are available for online consultations, teleconsultations, and the important thing is, get in touch with them and follow their advice. So that is all that is needed. And I don't think we need to be too apprehensive about a third wave affecting children very badly. I think we need to be optimistic and hope that things will not be as bad as as it is predicted to be. And so I would request everyone, be strong. We shall overcome. Thank you.